Top 20 health benefits of green tea. Number 1. Cancer prevention. According to the National Cancer Institute, the polyphenols in tea have been shown to decrease tumor growth in laboratory and animal studies and may protect against damage caused by ultraviolet UVB radiation. In countries where green tea consumption is high, cancer rates tend to be lower. Number 2. Heart benefits. The participants who drank at least 5 cups of green tea per day had a significantly lower risk of dying, especially from cardiovascular disease, than those who drank less than 1 cup of tea per day. Number 3. Lower cholesterol. Consuming green tea, either as a beverage or in capsule form, was linked to significant but modest reductions in total and LDL or bad cholesterol. Number 4. Stroke risk. Drinking green tea or coffee on a regular basis is associated with a reduced risk of stroke. Number 5. Prevent type 2 diabetes. Lower risk of developing type 2 diabetes for green tea drinkers than for those who consumed no tea. Number 6. Weight loss. Green tea may promote a small, non-significant weight loss in overweight and obese adults. Number 7. Inflammatory skin diseases. Green tea could hold promise as a new treatment for skin disorders such as psoriasis and dandruff. Number 8. Working memory. Green tea can enhance our brain's cognitive functions, particularly the working memory. Number 9. Contains healthy bioactive compounds. Green tea is loaded with polyphenol antioxidants, including a catechin called EGCG. These antioxidants can have various beneficial effects on health. Number 10. Improve brain function. Green tea contains less caffeine than coffee, but enough to produce an effect. It also contains the amino acid L-theanine, which can work synergistically with caffeine to improve brain function. Number 11. Increases fat burning. Green tea may boost metabolic rate and increase fat burning in the short term. Number 12. Protect the brain from aging. The bioactive compounds in green tea can have various protective effects on the brain. They may reduce the risk of dementia, a common neurodegenerative disorder in older adults. Number 13. Reduce bad breath. The catechins in green tea may inhibit the growth of bacteria in the mouth, reducing the risk of bad breath. Number 14. Prevent cardiovascular disease. Green tea may lower total and LDL, bad cholesterol, as well as protect the LDL particles from oxidation. Studies show that people who drink green tea have a lower risk of cardiovascular disease. Number 15. Help you live longer. Studies show that people who drink green tea may live longer than those who don't. Number 16. Diabetes. Green tea apparently helps regulate glucose levels, slowing the rise of blood sugar after eating. This can prevent high insulin spikes and resulting fat storage. Number 17. Tooth decay. Studies suggest that the chemical antioxidant catechin in tea can destroy bacteria and viruses that cause throat infections, dental caries and other dental conditions. Number 18. Depression. Theanine is an amino acid naturally found in tea leaves. It is this substance that is thought to provide a relaxing and tranquilizing effect and be a great benefit to tea drinkers. Number 19. Antiviral and antibacterial. Tea catechins are strong antibacterial and antiviral agents, which make them effective for treating everything from influenza to cancer. Number 20. Supports bone density. The antioxidants in green tea have been shown to protect against bone loss and reduce the risk of fracture,